for 2026. This time, if we could have a roll call, please.
Webb,
Here.
Hopper,
Here.
Ford,
Here.
Van Zant,
Here.
Lively.
Okay, it appears we have a quorum. I'd like to make a motion that we group items 1 through 7 on the consent agenda together.
It's 1 through 7 or 1 through 6?
1 through 7.
Okay, I'll second it.
We can-
Ford,
Yes.
Van Zant,
Yes.
Hopper,
Yes.
Webb.
Yes. Okay, moving on to item do we have any remarks or inquiries by the audience pertaining to any agenda items? Does not appear so. If we may move on to item number 8, the financial report.
Okay. The average daily census was 9.43. It's down 1 day from January and down half day from the 2025 monthly average. Acute payer mix for February was 81% for Medicare and Medicare managed care, with prior month being 86%. Swing bed payer mix for February was 83% for Medicare and 17% Medicare managed care. The 2025 year-to-date percentage for Medicare was 80% and Medicare managed care was 20%. Operating margin was $185,000, which is up $174,000 from January. The 2025 year-to-date operating margin was an average monthly loss of $36,000. Net patient revenue was $1.57 million for the month, which is an increase of $4,000 from last month and an increase of $146,000 from the 2025 monthly average. 340B revenue was $10,000. Expenses were $9,000. Operating expenses were at $1.5 million for February. This is up $71,000 from the prior month and $95,000 from the 2025 year-to-date monthly average. Patient days for February were at 264. This is down 62 days from January. Cash receipts for the month were $1.53 million. This is a decrease of $61,000 from the 2025 monthly average and a decrease of $182,000 from January. Cash disbursements were at $1.31 million, and our cash balance at February month end was $1.24 million, giving us about 24.8 days of cash on hand. For the clinic, the February average daily visits were 13. Year-to-date revenue for the clinic is $129,000. Operating expenses are $155,000, with a year-to-date net loss of $26,000. I think that is everything. You guys have any questions?
None for me.
None for me.
Thank you, guys.
Thank you.
Thank you. Moving on to item number 9, discussion and possible action to approve MRMC Blue Cross Blue Shield of Oklahoma Healthcare Services Corporation agreement for acute care hospitals.
Mhm. This is, we gotta renew our Blue Cross Blue Shield agreements every 3 years. And then I don't know, they have a stipulation in there that says it auto renews every year after that, but they still want a renewal every 3 years. So this is our 3-year renewal time. The last time we approved this was in 2023. No large changes in there that we noticed.
I'd make a motion to approve.
I'll
Vote.
second.
If we can call for a vote at this time?
Webb,
Yes.
Hopper,
Yes.
Van Zant,
Yes.
Ford.
Yes.
Okay, moving on to item number 10, discussion and possible action to approve MRMC Blue Cross Blue Shield Medicare Advantage Network Participation Agreement for the hospital.
This is just so we can accept the Blue Cross Blue Shield managed Medicare patients at our facility. So again, Blue Cross Blue Shield every 3-year renewal agreement.
Like
I'd
to-
make a motion.
I would like to second that motion. If we could call for a vote at this time, please.
Webb,
Yes.
Hopper,
Yes.
Van Zant,
Yes.
Ford.
Yes.
Item approved. Moving on to item number, 11. Discussion possible action to approve the renewal agreement between MRMC and Stericycle for regulated waste disposal.
So when we brought this is a renewal also from the last Stericycle agreement that was on record for Stericycle was under Alliance. So they wanted to bring forward a new agreement with a new board, with a new name, and all, and everything. The cost is not changing, they're still the same at $38.69 per container for a minimum pickup cost of $193, no matter what. Even if they pick up one container, it's $193. If they pick up more than the $193, then that's what the cost will be. And then our clinic is $60 per container, since it's considered an accessory site or off-site.
So they don't have the minimum.
They do have the,
Amounts.
they do have the minimum of $193 at the clinic.
In addition to the hospital, the clinic. That seems.
But we don't
excessive.
pick up at the clinic very often. They don't pick up at the clinic like, they have to schedule their pickups. Our pickups are routine, I think ours is monthly, theirs is quarterly. So the cost is not,
Yeah,
you're not getting it
they're probably
every month.
gonna pick up both of them at the same day.
They haven't been. They like to pick them up
That's
quarterly.
ridiculous.
I don't disagree.
This was my pet peeve when I
Mhm.
had
It's
clients,
ridiculous.
is how much we had to pay for this
I'm a little more
ridiculous thing.
upset because of what I pay versus what y'all pay, so.
Well, you
Well, you have
got different
different
things, buddy.
kind.
We're not putting a leg in there.
Yeah.
No,
But
no.
It is,
I mean, some hospitals do, yes, and their cost is more. Their bio is more. But this is our cost for our facility.
I'd make that motion.
I'll
Carson's
second it.
gonna renegotiate his contract, watch this. Aren't you?
Hopper,
Yes.
Van Zant,
Yes.
Ford,
yes.
Webb.
Yes.
The next one, oh, go ahead, sorry, Carson.
No,
My
you're
fault.
fine. Item number 12, discussion possible action to approve the agreement between MRMC and Stericycle Pharmaceutical Waste Disposal. Sorry,
Okay.
go ahead.
This is for our pharmaceutical waste destruction, that we have to do per the FDA, can't flush things down the toilet, so this is our pills that we can't send back, different things like that, and it's $228 per month. Prior cost was $215 per month for 36 months. Each additional container, so we get one container in the pharmacy, and literally we've not filled up one the entire time. When they come to pick it up, it takes about 6 months for us to actually fill one up if we were to hold it on site. But every additional container would be $247. We do not keep the additional stop. That would be at the hospital, the 517. We do not keep these at the clinic. This is only hospital in the pharmacy that they deem hazardous, that we cannot flush or throw in which we can't do anything in a biohazard container, so.
So regardless if they pick up monthly or not, we pay that even
No
though
matter
they
what,
may pick up
yes.
every 6 months?
Yes, sir.
I'd like to make a motion that we approve.
I'll second, because you really don't have a choice.
Nope.
Webb,
Yes.
Ford,
Yes.
Hopper.
Yes.
Van Zant.
Yes. Moving on to item number 13, discussion and possible action to approve the MRMC MedPro renewal agreement, providing general liability and professional liability insurance and employee benefits liability.
Yep, this is our professional liability insurance that we get for the facility and for the providers. Prior cost was $60,488, and we do, if y'all remember, we do this monthly. We do a monthly payment on this, so that will be coming too. That was the prior cost. Current cost is $65,991. The increase is due to we have increased number of providers that can work at our facility that we've credentialed. So that's the only reason we've had the price increase.
How many did we?
We've added 3 nurse practitioners so far. And that just increases, every time they have to have another nurse practitioner, increases the cost a little bit. But again, the nice thing we like about MedPro is it has the tail coverage that we've had this entire time from when I was here previously. So it covers us for lots of years.
I'd make that motion.
Second. We could call for a vote at this time, please.
Ford,
Yes.
Van Zant,
Yes.
Webb,
Yes.
Hopper.
Yes.
Okay, moving on to item number 14, discussion possible action to approve DA Engineering LLC Engineering Services proposal for lab renovation.
So our architect reached out to us, I think I brought that up last time. Our architect reached out to us, said the state is requiring us to have an electrical engineer to do the lab move. He's worked with DA before. He's talked to several other electrical engineers. No other electrical engineers, that's why you only have one agreement here in Oklahoma City, are willing to quote a project this small and come out and do it. So, they're estimating the cost, and this is why we brought it to y'all. It's in excess of $4,800, right around $4,800 is what they're estimating. It is under the 5,000 cap, but we wanted to make sure y'all were aware that this is gonna be an added cost to the lab move to get them into the facility. But it is something that the state is requiring us to do.
You're all in the wrong profession.
Yes, did you see those hourly rates?
That's what I'm saying,
Me
we are
and
all
Nick
in the
saw
wrong
that, and we're like,
profession.
wow. I mean, an administrative support staff of $100 an hour, I will take it.
Right.
Yeah. So again,
So it's fixed at 46.75.
yep, that's what they're estimating it should be fixed at, that amount.
And when are they
Well-
gonna do it?
As soon, after we sign the agreement, they will come out and do their paperwork, have to submit it to the state, and you know how that is. So, the state's not in a hurry to do anything, so.
So I read fixed differently.
Mm-hmm.
Fixed to me means that is the cost.
That is the cost, correct,
There
but they
won't
have to
be
put their
anything in
hourly rate.
Abundance of that, that if they use more hours than what they thought, that is our
It's-
cost.
That is our cost, $46.75.
I'd make the motion.
Second.
Call for a vote at this time, please.
Hopper,
Yes.
Ford,
Yes.
Webb,
Yes.
Van Zant.
Yes. Then moving on to item number 15, discussion possible action to approve CNA insurance quote for directors and officers of entity liability coverage per employment practices of liability coverage part.
Again, this is a renewal of our D&O policy. As you could tell, our cost didn't go up at all. It was the same as what we had last year. This is the exact same company that we used last year.
I'd like to make a motion that we approve.
Second.
We could call for a vote at this time, please.
Ford,
Yes.
Hopper,
Yes.
Van Zant,
Yes.
Webb.
Yes.
Okay, moving on to item number 16. Discussion possible action to approve MRMC and Communicare Technology, DBA, Pasari, DBA.
Okay, so Pulsara is, Nick and I was a part of a exercise. They really kind of showed us Pulsara. So what Pulsara was, and all the EMS agencies around in our area are starting to use Pulsara. It is a patient tracking tool. It is free for us with this BAA. It's free for the hospital. They can take a picture of whoever's on site, say they don't know a name, they have no identification marks, it is a mass casualty. They can take a picture and then send it to our Pulsara that we're gonna get this patient, and we can track with no name. We don't have to put John Doe 1, John Doe 2. You can actually track by physical features, tattoos, different injuries. They can put the injuries on there, so you kind of know what you're getting. But it's a communication tool between EMS and the hospitals, and it's even free for EMS. They've got a proposal at the state to do the non-free version, which is more of a patient tracking. So if I send a patient from our ER to OU Health, I can literally track that patient through this for the state to pay for it, not for hospitals to be having to pay for that cost. Lots of hospitals are using it in Texas currently. This, again, is not an exclusivity, we don't have to use, but they can actually give a report through this system. And it will alert us if we have it up, that we have a patient incoming from an ambulance, or if a helicopter service is using it. I mean, which we're not gonna get a patient via that unless they're bad off. But you can actually get all the information from the crew that is on scene at the time.
Would the, like EMS and them have to be a part of this as well?
And they are a part of it.
They are?
Our EMS is a part of it. The only one we noticed that wasn't, and it was kind of interesting, but they're in the beginning phases, is Jackson County. But Greer County they're waiting on us, according to what the Pulsar rep said. Because they didn't want to do it if we're not going to do it, because they're going to be encoding to us and bringing us patients in a mass casualty situation.
And this isn't one of those situations where we pay nothing now, but
According to the rep, it's not. If we stay with the free version, which we don't foresee OU don't need the free version. They need the, because again, more patient tracking of where people go, but we don't need that. We don't send that many out and don't have that many mass casualties or anything like that, so.
I'd make the motion.
I'll second it.
Webb,
Yes.
Ford,
Yes.
Van Zant,
Yes.
Hopper.
Yes.
Okay, motion carries. Moving on to item number 17, discussion possible action to approve the termination letter
Title Care.
Title Care,
Yep.
telehealth services.
So Title Care was purchased with COVID funds. It is a telehealth platform that, since Nick and I have been there since 2023, it's never been used, never out of the package. So we reviewed the contract, we talked to our IT department, they're like, yeah, go ahead, because this is we're within the window, the 60-day termination notice. We're just tied into them for another year. We're not tied into, y'all paid the 60 months in advance, cash up front. Reading the agreement, it didn't spell out that we had to pay any more money, but we're not utilizing it. So to have this agreement, it would be essentially, I hate to say worthless, but a not needed agreement for us, for our facility. So we figured we'd go ahead and do a termination agreement.
I'd make the motion to terminate the agreement.
I'll second. Are you guys using any telehealth services?
Not currently, no.
I didn't figure, but.
We're trying to work out one with another entity, and that hopefully will be coming to y'all the next month.
Yeah, I'll second the motion to approve.
Ford,
Yes.
Van Zant,
Yes.
Webb,
Yes.
Hopper.
Yes.
Moving on to item number 18, discussion possible action to approve April Summerlin as the MRMC infection specialist.
So Megan, as y'all know, y'all approved her to go to Quality last month. This is her replacement. She works at Carnegie and Mangum, so she's split between the two facilities as the infection preventionist. We did have a ad placed. We weren't getting any bites, any potential candidates for that position, so we combined it with Carnegie and sharing the cost of her salary.
So we're paying half the salary
Mhm.
and half the benefits
Yep.
than what we were before.
Yes, correct.
And they'll be able to manage both facilities?
She has logins to both facilities, and she can see everything at both areas at the same time, yes.
How often is she?
3 days 1 week and 2 the next, so 5 days
So
in a
it's
10-day period.
truly half.
Yes, truly half.
You need a motion to approve it?
Yeah, y'all got a appointer.
Okay, I'll make a motion to approve that.
I will
arrangement.
second it.
Hopper,
Yes.
Ford,
Yes.
Webb,
Yes.
Van Zant.
Yes. Moving on to item number 19, discussion possible action to approve declaring both non-functional autoclaves as scrap.
So both of our autoclaves that were in the surgery area, the small one, it has a hole in the pressure chamber that the bolt has been broke out of, and it's non-functional. Like, it won't hold pressure, and it is several years old. All the fittings leak. The last time they pressured it up, it wouldn't even pressure up. So talking to our boiler inspector that inspects the autoclaves, he recommended that we take them out of service. We completely unhook it, both of them, and we'll get to the other one in a second, because they're both non-functional. So to bring them up to usable, it would cost somebody more money than it would to buy a new autoclave. Same thing for the big autoclave that's in the sterile processing room. The entire electrical components of that machine are outdated and would have to be updated. Last time we talked to Steris, it was gonna cost more. Last time Mark talked to Steris, I have not talked to Steris. This was years ago. They told him, you might as well just buy a new sterilizer because it's gonna cost you more money to upgrade this one. And you're gonna have to redo all the copper piping because it hasn't been used in so long that you might as well just put a new one in. So with that, we wanted to declare them scrap so we could dispose of them and not put them on the auction site. As you can tell, the other 3 we want to put on auction site, or the other 2, sorry.
Like there'd be nothing that could scrap? I mean,
We could take the copper for scrap and do things like that, but I mean, what do you do with that money as, you know, I guess miscellaneous income. I
I don't know.
have a CFO here. Yeah,
I just like
but we have to declare it as scrap to be able to do that.
to scrap it.
Yep.
And I'd make the motion to declare both as scrap.
I'll second.
Van Zant,
Yes.
Ford,
Yes.
Webb,
Yes.
Hopper.
Yes.
Moving on to item number 20, discussion possible action to approve to auction 4I beds and stretchers.
Slash stretchers, so they
Slash
are,
stretchers.
they are the same thing. It's what they used for ophthalmology. They haven't been used since surgery stopped at Mangum. They were just sitting in a room covered up with sheets. This way we can put them on the city's auction site and auction them off. They're worth a decent amount of money, I will tell you that. So, but we have no utilization for them at our facility.
I'd like to make a motion that we approve the sale or auction of the 4I beds and stretchers.
I'll second that.
We can call for a vote at this time, please.
Webb,
Yes.
Hopper,
Yes.
Ford,
Yes.
Van Zant.
Yes. Moving on to item number 21, discussion possible action to approve the auction of one anesthesia machine.
And it is not a full anesthesia machine. It has been picked apart again previously before we were there. It's missing the monitor, it's missing some other things, but it's one of those things that somebody could use. They are good for quite a long time, so that's why we want to auction them off, because they can put the pieces back together for it. It's just sitting in our room collecting dust, so.
Where's the rest of it?
I'm guessing it was sold off. From what I was told, the monitor was sold previous to Cohesive coming in. That's what Mark has told me. And then some of the other pieces, they just probably thought they were useful somewhere else. I have no idea. Yeah, again, it's worth a good little money, kinda like the stretchers. We might get a couple thousand out of it, so something to sell.
I'd make that motion.
I'll second it.
We could call for a vote.
Ford,
Yes.
Hopper,
Yes.
Webb,
Yes.
Van Zant.
Yes. Moving on to item number 22, I'd like to make a motion to enter into executive session.
I'll second.
Webb,
Yes.
Ford,
Yes.
Hopper,
Yes.
Van Zant.
Yes.
Go ahead.
You been working out or something? Yeah. Have you? Good, yeah.
like to make a motion that we come out of executive session.
I'll second that.
If we could call for a vote, please.
Webb,
Yes.
Van Zant,
Yes.
Ford,
Yes.
Hopper.
Yes.
Okay. I'd like to make a motion that we approve Ryan Sand and Nelson Ungar.
Ogumbo?
No, I think, no, what I would do is I would approve Ryan first, yeah.
Okay, I'd like to make a motion that we approve Ryan Sand.
I'll second.
If we could call for a vote.
Webb,
Yes.
Hopper,
Yes.
Van Zant,
Yes.
Ford.
Yes.
Then I'd make a motion that we approve Ashley Lindsay as to credentialing her as only to the clinic.
I'll second.
If we could call for a vote.
Hopper,
Yes.
Webb,
Yes.
Ford,
Yes.
Van Zant.
Yes. Okay.
And then a motion to re-credential Nelson Amebo, Ogimbo.
Gimbo.
I'll second.
Hopper,
Yes.
Ford,
Yes.
Van Zant,
Yes.
Webb.
Yes.
Do we have any staff or board remarks from any of the governing board members, hospital CEO, city attorney, or city or hospital employees?
Dennis has something, but it's more, I think it's under new, we'll go on into business as well. It's just about a grant that's out.
Okay, moving on to new business. Do we have any new business? Dennis, you're up.
Okay, as you may remember, we've been talking about the OBBBA, known as the Big Beautiful Bill, and as a reminder, the state of Oklahoma projected loss primarily in Medicaid, beginning in like years 2030 forward of about $5 billion. And to help confront that, Congress passed the Rural Health Transformation Program, which was supposed to give us about $1.1 billion back to the state beginning this year. So that's 20% of what the projected loss is down the road. But again, those are all speculations, and it's a long way away. Well, as part of this Rural Health Transformation Program, they've started these micro grants, and our first one is we have to submit an application between now and April 13th, and this just came out last week. This is only for about $50,000. It's attributable to every county that you provide health care. So if you were critical access and covered 5 counties or an entity that did, you could apply for up to $250,000. So we are in process of doing that. All of our facilities are working on that piece right now. We plan on doing a submission hopefully next week. So anyway, and the funding period, or when it has to be spent, is between now and October 26th. Again, this is $50,000. It's peanuts in the whole scheme of things, but this is one of the first things that they're starting. We really just want to make you aware that we're on top of this and we're working towards it right now. There's a list of that these funds can be used for, primarily like a certain qualifying equipment and healthcare education, wellness, that type of thing. And there's a laundry list of things that cannot be used for, really that pertain more to your current operations. So anyway, but that list, and we can provide that to the board. I already have printed those out and sent it to our team, so we have that. But again, this is more just a FYI. This is what we're working towards. And I will tell you, not that my opinion matters, but if someone were telling me I was going to have a $5 billion deficit in a few years down the road, and today they were only going to give me 20%, I don't think I'd be spending it. I'd probably be investing it to minimize the blow that was coming down the road. But again, apparently they plan on spending this, and I'm not, none of us are over those decisions. But so again, this is just a heads up, and if you have any questions, we can try to answer those, but it's all we know at this time.
So is each facility applying for the grant separately?
Yes, ma'am.
Okay.
We sure are.
Now, do we
Good
get to
question.
apply for, like, since we have patients who come from Jackson County and Harmon County, or do we have to have physical locations in those counties?
Yeah, wherever if you provide services, and again, I would recommend, but I know our operations team is on top of this, and that is, we wanna try to apply for as much as we possibly can.
Maximum we can get, Dennis, if I'm not correct, is 250,000, correct?
Wow.
Yeah, if you up to, and it's basically 50,000 to a max of 5 counties if you have some type of provide care for.
That's awesome. Thank you.
And it has to be spent, it can't be invested in any way.
That's correct, yeah, and it has to be used between now and October 30th, and then you have to report it, and provide proof, after that, you've got a month through November 30th. And the good part too, again, this is a grant, so on your cost report, there's no offset, so it's good for critical access hospitals. It's not like 50% of some money that's going to have to be offset on your cost report, and you only benefit, 20,000 or something. So this is 100% cash, whatever we can get.
And the deadline to apply, you said is April 13th.
First draft, or the first draft
Of the grant.
application is April 13th. Yep.
Sounds great.
Thank you, Dennis.
Is there any other new business? Okay, I'd like to make a motion that we adjourn.
I'll second.
We could call for a vote, please.
Ford,
Yes.
Hopper,
Yes.
Webb,
Yes.
Van Zandt.
Yes. Meeting is adjourned.
End of that quick.
Yeah. Ding, ding.
Go ahead, Corey, have him sign her stuff, because he's got a bunch to sign for me.
Disconnected.
Just the minutes. Just hit the red circle on the screen and then hit confirm.
You got it.